when thinking about becoming a doctor, I feel like we all want to do this to help people, and many of us have personal experience with family members, and we saw what good can come of it. But a really important part of medicine is also that it's kind of like every case is a puzzle. It's complex, and so when treating these patients, it allows us to use our critical thinking skills, our problem-solving skills, and ultimately there's a good outcome for the patient and their family, and that's ultimately the most important thing. What's really rewarding about being a doctor is that we put the emphasis back on the patient. The patients are multidimensional. They, have their family priorities, they have their job and their career that they've spent time building, and oftentimes they kind of deprioritize themselves and their health. So when, these things come to a head and they come to the hospital and we're helping to treat them, in that moment, in those few moments, nothing else matters. It's them and their health, getting them, back and feeling well again. And it kind of reinforces the importance of kind of, paying attention to you and your health. And then as an added bonus, you help them get them back to 100% so they can do, all the things they love to do in life. What I love hearing from my patients is when they ask, what more can I do? Right? Like I'm happy to order labs and medication, imaging, and procedures, of course. But it's nice to hear from patients, what can I do? Because it kind of reinforces that all this medical treatment is really a partnership. It's a commitment between both of us, and I'm happy to do my part. But it just shows that they are also invested in themselves, right? Like, what lifestyle modifications can I do? How can I change my diet? Do I need to exercise more? It shows that their health is important. And so it makes me, proud to be their doctor and help them in that partnership. So one thing patients might not know about me is that I've always loved to read from a very young child. And during college, I was a humanities minor. And so, I really actually liked reading like English and Russian literature. So always happy to discuss with patients if they have that type of interest. I'm Dr. Alana Persaud. My mission at Jefferson is to improve lives.